Good
Enter the
afternoon.
room.
Good afternoon. My name is Dr. Oluwakayode Komolafe. I'm one of the junior doctors in this department. Could you please tell me your full name and your age?
Hi, doctor. My name is Emily Turner, and I'm 16 years.
Okay. How do you prefer I call you for this consultation?
Emily is fine.
Thank you, Emily. Emily, will you please tell me your homework, the reason why you want to see us today?
Oh well, it's basically my mother. She's really worried about these, problems I've been having. I've been having these pains in my tummy for a while since morning. It's been there for like, past month. And personally, I kind of feel kind of weak, and it's kind of getting worse with time. Yeah.
Okay, if I understand you well, you have pain in your tummy, which started about a month ago. Is that correct?
Yes, that's right.
Okay. Now, this pain, where exactly do you have this pain in your tummy? Can you localize it?
It's all over. It's kind of like around all over my tummy. I have pain.
So the pain started gradually or it started suddenly? Is it worse
I
at
mean,
any point of the day?
no, it's mostly mornings. I actually experience them very severely. And yeah, initially it was just like a dull thing, but now it's kind of getting like every day. I feel it's kind of getting worse.
Oh, sorry, dear. Do you think there are certain things that make this pain worse or make it better?
No, nothing really. Not sure. Nothing like that.
Okay, okay. In addition to this pain, do you have any other problem?
I don't know if it's a problem, but I kind of feel thirsty a lot. I drink a lot of water, and it kind of makes me pee a lot. I pee like around, I have to get up like 4 to 5 times at night to go to pee, and it kind of makes me so tired. I'm not able to sleep well.
Okay, okay. This you pee, do you notice pain while urination?
No, not really. No pain. I just feel like I'm drinking so much water. I may have to pee because of that.
Okay, so there is increase in thirst and also increase in the way you urinate. Is that correct?
Yeah, I guess so.
Okay. Do you have any recurrent infections or boils over your body?
No, doctor.
Okay, thank you. Do you notice that you are losing any weight loss?
No, I'm not sure. No, I don't think so.
Okay. Any swelling in your tummy?
No, it's just the pain that I have.
Okay, thank you. I'll need to quickly ask you some questions about your background state of health. Now, tell me about your menses. When did you start your menses?
Oh, around when I was 13, I would say.
Is the menses regular?
Yeah, they haven't been a problem.
Okay. Do you use any contraceptives?
I mean, I haven't really started, doing it.
Okay, I understand you. I understand you. Do you have any family history of diabetes?
Oh, I don't know, doctor.
Are you currently using any long-term medications?
Oh, no, not really.
Okay, thank you. What do you think might be responsible for this condition?
I'm not sure, really. I don't know. I've never felt like this before.
Okay. Do you think what is your greatest worry concerning this condition, and what do you think we might be able to achieve for you today?
Well, it's, I guess, my mother's peace of mind, for one. But I would like it if I don't pee so much at night. I mean, it's kind of interfering with my sleep.
Okay. Do you pee? Do you wet your bed at night?
No, doctor. No, I
Okay.
just get up and pee.
Okay. Okay. Thank you. I would quickly like to examine you. I would like to do a general physical examination, check your blood pressure, respiratory rate, oxygen saturation. I will need to examine your tummy as well. I will need to check your urine. Okay. Thank you for what we've discussed and the outcome of the investigations. I think you have a condition called diabetes. Do you understand that?
What? Isn't that old people problems? I'm like 16.
Yes, I understand you. It's common among old people, but it's not strictly an old people's problem. Young people too can have it. Do you
Okay.
understand?
Oh, I see. Okay. All right.
Yes.
Why do
What
I
really,
have it?
what really happens in diabetes is that there is high level of sugar in the blood, and this is often caused whether a hormone
2
that
minutes
helps us
remaining.
to make use of sugar called insulin, is whether the insulin is not produced in adequate amount, or is produced but there is resistance to its function. Do you understand that?
Okay. All right.
O-
Okay, fine, doctor, but why do I have it?
Okay, thank you.
How
So
did I
what we
get
are going
it?
to do now, we are going to admit you.
What? You're gonna,
Thank you.
I can't get admitted. I have an exam tomorrow. I have to prepare for that.
I understand you because you have exam, but your health is important. The reason is because this is not just ordinary diabetes, but it is a case of diabetic ketoacidosis. It's a complication of diabetes.
I don't understand what is this ketoacidosis? Like what I can't get admitted. I have to go back home and study, doctor.
No, it's important that we admit you. We need to discuss with your mother as well. When we admit you, we are going to carry the blood sample to look for the ways the blood, the amount of sugar. We begin to monitor the amount of sugar in your blood. We are going to give you fluid in adequate quantities so as to prevent you from going into dehydration. Then we are likely going to give you insulin. Do you understand that?
Okay, all right.
Yeah. So it
Yeah.
may take. I'm going to give you a leaflet where you can read more about diabetic ketoacidosis. But if you notice that your condition is worsening, like loss of consciousness, you are becoming drowsy, or your abdominal pain, tummy pain, please let any member of staff know about it.
Move on to the next station.
Good job, doctor.
Yeah, thank you.
That was great. That was great. So yeah, so you're actually talking to a child, right? And you did manage to rule out a lot of associated conditions like UTI, but you didn't signpost the actual history. You're actually talking to a child, so you need to ask that. Like that's signposting is very important. You're going to put them in a very difficult situation if you don't signpost all these private, history questions. Apart from that, one thing I would like to say is when you're explaining diabetes, I kept asking you the question, how did I get it? Right. So this is type 1 diabetes, right? So you could have explained it that this is something where, your body is making some antibodies that are attacking your a very vital organ called the pancreas, which makes a very vital hormone called insulin. So because of the insulin deficiency, you have been experiencing symptoms where you are very thirsty and this is making you want to go to the washroom a lot, right? And you've been experiencing these abdominal pains. These are all part of your this diabetic problem, and now it's come to such a point where it's become an emergency, unfortunately, and this emergency is called diabetic ketoacidosis. So now, because your sugar is not, insulin is a very important hormone to digest your sugars, and because your sugars are not getting digested properly, it's making something called ketones. And when ketones are on a high concentration, they can cause you a lot of problems where it can even cause you death, right? So now, if you say that much, she'll get scared enough to stay in the hospital. So now,
I'm sorry, but did you realize that this is DKA?
Yes, I said it. I said diabetic ketoacidosis as a complication of the diabetes.
Got it. But I mean, like, did you? I didn't see that you, trying to show some, that it's an emergency. So
I
you
said
kind
it. That's not. It's not an ordinary diabetes, but a complication called diabetic ketoacidosis, and we need admission.
of okay, that's good. Yeah.
yeah, you did mention the admission part, but you need to emphasize on the emergency part.
Okay.
I'm saying this mainly because they are going to, especially if it's a patient that is refusing admission, they will fight you on that. So how do you make them stay? You have to tell them the complications of the diabetic ketoacidosis to the point that you can die, right? In her mind, she thinks that the exam is more important, right? But that's not really the case. At this point, you are trying to tell her that if you don't get treated properly, this can actually cause, you to lose your life. You have to get across to them that way, right? So this is an emergency where these ketones are produced that can cause a really bad effect on your body, where you can lose consciousness to a point that you can go into an indefinite state of coma. So we have to give you management immediately, right? So now if you say these words, they don't have an option. Right? So you have to, that's how you convince the patients, right? So if they are saying that, no, I don't want to get admitted, all you're saying is that it's an emergency, it's an emergency. For me, the real emergency is failing my test. I don't see your emergency. So you have to make it clear to me that why is it an emergency according to you? Right. So that's one good way to get across to them. Like there are cases where there is a patient with breast cancer who's refusing chemotherapy. So how do you get across to them? You ask them, do you understand what will happen if you don't take the medication, if you don't undergo chemotherapy? So then they'll be like, it's okay, it'll just grow and I don't want to, it'll look distorted. I understand that that is one of your concern, but the concern that I am worried about is that this cancer can spread to an extent where it can affect your brain and other organs, and you can actually lose your life because of it, right? So if you get across to them like that, address them what your concern is rather than them giving importance to their concern, which is actually pretty trivial. You need to show that the concern that you're addressing is way bigger than their concern, right? If you show that, if you try to bring that point up, then they are more likely to agree to you. But ultimately, it's the patient's choice. So you can always, I mean, at this point, you were like, I'm just going to ask your mother and she's going to admit you. But she's 16 years of age. She has autonomy. If she doesn't want to get admitted, she won't get admitted. Right? So you have to convince her first. And also, you have to bring her mother in. I'll also inform your mother. She'll help you understand this better. Right? You have to convince the patients, even though they're children. You have to somehow manage to convince them.
Okay.
All right, let's look at how it went. All right, so we have full name confirmed. So there was no name that was given. Sometimes the cases come without a name as well. So try to confirm that. The identifiers which are given to you, try to confirm whatever you have at hand. Right? So that was confirmed. And because sometimes this is, if you understand, you are the setting of an emergency. So in emergency cases, I mean, it's always a rush. So sometimes some information here and there might be missing. So try to get it all, adequately, properly from your end. And you have assess the symptoms, rule out anorexia. So you need to understand why she's having the tummy pain. So other, problems you can actually rule out, like anorexia, any malignancy. Do you see any lumps and bumps in your body? She's been tired, like, is it chronic fatigue syndrome? Has it been lasting for like a long time, right? Hemoptosa, like family history, you asked allergy. I think this was very well covered. And other than that, effect on life, difficulty concentrating. Exactly how is this affecting your life? Because she said that she's been having tummy aches and she's been having these urination problems. Like she said, nighttime it's difficult, but how else is this affecting your life? To understand what's the extent of this disease affecting their daily living, and difficulty concentration. And ice was asked, but sometimes that's what, no, ice, when you ask them, it's their concerns, so you need to understand what their concerns are. Even though you have a more pressing concern from your side, you need to understand what they are thinking in order to properly formulate what you have to put across to them. And you have conduct systematic exam to check. I don't think you mentioned all the tests. I think that's one of the reasons probably why Dr. Rohit also might have got confused, because when you're thinking of diabetic ketoacidosis, you have to talk about the urine analysis, the blood glucose. So since it was already there in the question stem, the findings,
I mentioned
it was easier
that you are
for
going
you
to
to
carry out
get to that.
urine test. But I didn't mention
Okay.
blood glucose.
Right. Okay. Yeah. So most of the times they will not give you the clipboard unless you mention the test. So unfortunately, we don't have that kind of a system set up yet. But we'll definitely try to do that, because only when they mention the test, if you can show the thing, then you won't get an idea. Then you'll know how it is actually in the exam, right? Unless you say the test, they won't give you the clipboard. So this is a case where you can completely miss out the fact that this is DKA. Think of it in a way where this patient, you're actually seeing this patient. So what all are the blood tests that you need to order for this lady in order to see what she has? So unless you order the blood test, you will not get the result. You can completely dismiss the fact that she has DKA altogether if you don't order the right test. Another thing is summarize and ensure she understands the condition. So she didn't understand the severity of this condition. That is one problem in this case, because she was fighting you on the fact that, no, I don't want to get admitted. So you need to put across the issue altogether, like this is the issue, and that's why you need to get admitted. Otherwise, it was a great performance. This again gave you like 4 to 8 marks. That's not bad. 8 out of 12. That's pretty good. I guess, Dr. K, you got like a good hang of this. Not bad.
Thank you.
Dr. Rohit is here. Dr. Rohit, do you want to add something?
No.
All right. So we have finished so far 5 cases. So we will take a short break if that's all right.
Okay. So what do we resume?
So this will be, we'll treat this as a rest station. So after 5 cases, you will be having a rest station, like I explained you in the beginning. So let's take like a 15-minute break. Is that all right? Does that sound good?
Yes.
Because in a rest station, you will be getting 1.5 minutes of reading time and 8 minutes. So a total of 9.5 minutes you'll be getting. So we'll just extend that a little bit and take 15 minutes. Is that all right?
All right. That's all right.
All right. Okay,
so we'll
then.
Stay in the call. Can you just turn off your camera and mic?
So I just want to tell you what will happen in the rest stations. So the rest stations are the times where you can go to the washroom. So, try to hold off until then. Usually, they will ask you, do you want to go to the washroom? There will be, a room where you can hydrate. There are cookies where you can, eat cookies. So that's a station where you can just sit down and relax. If you want to go relieve yourself, that's also something that they, allow you at that time.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.